treating patients with heart failure, it's an individualized treatment. Not everybody can go with the same treatment. Not everybody wants the same treatment. With treating advanced heart failure, you can go as serious as having a heart transplant or something called a left ventricular assist device. These are both open heart procedures, but there's a lot of patients that actually, they don't think that that's for them. And so we try to specialize and individualize our treatments of each of our heart failure patients. We have a unique opportunity to where there's multiple types of devices that are coming out, here in the future that we're able to use. One of the first ones that we're using is something called a CardioMEMS device. And a CardioMEMS device is a small device that's placed into the pulmonary artery and able to read pressures so that we can actually treat patients' fluid overload from their house. One of the second options that our patients have is a mitral clip. And that is an option that is actually done by our structural heart team here at Advent Health. And so with a mitral clip, sometimes when a patient has a mitral valve that is leaking, that can cause them to have a lot of fluid overload. And so because of that, we can do something as a mitral clip, but these patients have to be evaluated in order to be able to determine if they're a candidate for those. So that would be a second option. A third option is something called barostim. And so what that is it's a small catheter that they lay upon the carotid artery. And what that does is that stimulates baroreceptors in the heart. And when it stimulates the baroreceptors in the heart, it helps the heart to function better. So that's a third option.